I'm 16 years old and I've had juvenile rheumatoid arthritis for 13 years. Damn, no, I messed up. I've had it for 14. I was diagnosed with arthritis when I was 2, and we knew that something was wrong with my ankle because when most kids were learning how to walk, I wasn't walking. My ankle was so swollen and so stiff, it just really wasn't moving.
Between 1 in 10,000 and 1 in 20,000 kids per year in the United States will be diagnosed with juvenile arthritis. The official name of juvenile arthritis is juvenile idiopathic arthritis. And what does idiopathic mean? That's a fancy doctor word for we don't know what causes it. So we don't know what the cause of juvenile arthritis is. Genetics certainly play a role, but it's not an absolute role like in other diseases. This is a much more subtle genetic predisposition that our kids have inherited through their family.
After a couple of doctor visits, we found out that I had arthritis. I was starting intensive therapy, steroid injections, and heavy medication to be able to mobilize my ankle.
This is still a relatively new area of medicine. Are there research efforts going on? Absolutely, and they are federally funded, so the NIH and its various institutes do fund efforts to do research in juvenile arthritis.
I was at summer camp and all of a sudden I felt like my legs couldn't hold up my body anymore, and at that time I was about 82 pounds, so there really was no reason why my legs shouldn't be able to support, 80 pounds. And then when I had gotten off the bus from summer camp, my mom saw the size of my knee and saw how huge it was. And then we rushed into a doctor's appointment to get an x-ray thinking that I had broken my knee. And then after about 2 months of trying to figure out if it was a fracture or if it was a flare, we realized it was another arthritis flare. I didn't just have arthritis in my one right ankle anymore. I had had it in both my ankles, both my knees, some of my fingers, my lower right side of my back, and just kind of some other sore places without having official diagnosis.
Respect that it could come back even if it seems like it's been gone and under control. So the potential triggers are things that activate the immune system. The idea is that the children inherit some kind of predisposition to an unusual or exaggerated inflammatory response to something that would normally activate the immune system, things like infections.
From there, I've had to start medications that I never thought I'd have to take. And to help me with my pain management, I started going to a pain specialist. And from there, we did kind of a more holistic approach. I take 3 injections, and I'm not a big fan of needles. So to be able to take my medication, we play this really silly song.
Take your medication, Roman. Take a short vacation, Roman. You'll be okay. You need to know your station, Roman. Some alterations on your clothes and your brain. Take a little break from your side.
There is not a single test that we can use to diagnose arthritis, and that makes our field a little different from other areas of medicine. What we need to do is we need to understand the symptoms. We need to talk with the patient and the parents and understand exactly what it is that's going on.
I felt like, only, old people get arthritis, even though there are like 300,000 kids in America alone with it.
They're kind of amazed and they say children get arthritis, or children get lupus, or children have these diseases. These are important conditions because, number one, we're talking about great kids that have the potential for developing a chronic disease that can really affect them in the future. We have an opportunity to prevent that so that doesn't happen. And our goal for all of our kids is to have their inflammatory autoimmune disease completely in control so that they're normal kids and can do everything that they want to do. We can't cure, but we can mend. I make sure for my patients that doesn't tell them that they can't do something.
Arthritis does not have me. I have arthritis, and I can do whatever I want.